Also heard from the State Emergency Management Office today on how Oregon is doing when it comes to PPE. The director said he expects the state could be short on supplies for several months. Fox 12's Camilla Ortiz is live with just how short we could be and how that's impacting local nurses.
Well, Pete, the emergency management director said today this is like mile one of a marathon. He explained how the state is going about getting more PPE, but that it hasn't been easy and it won't be for a while.
These are really extraordinary circumstances.
Emergency Management Director Andrew Phelps giving a grim update Monday on personal protective equipment.
We're really looking at our burn rates, how much PPE is being used kind of on a daily basis, a weekly basis by our healthcare providers, and we're estimating that this is going to happen. There's going to be this need for the next several months.
That's even as emergency management teams are doing everything they can to procure more. Phelps said the state didn't even set a spending limit.
We're buying what we think we need.
But what we need and what we can get are two different things. Even with 135,000 N95s and 300,000 surgical masks expected to be processed and distributed this week, Phelps said we're still hundreds of thousands short, which is why hospitals are asking medical workers to reuse equipment, including masks.
If I'm going to reuse it, I'm contaminating myself and other patients.
I talked to an emergency room nurse who works at the VA hospital. She told me nurses there are being told to place their N95 masks in a paper bag between uses.
So I'm going to use the same mask but going to another patient's room and to another patient's room. And the mask doesn't get cleaned off. It just stays that way for the whole duration of my 12-hour shift.
An infectious disease expert told me the problem with that is that while the mask will block droplets containing the virus, it won't block the virus itself, which is why those masks typically get thrown away after one use. Experts say the best thing to do would be to use UV light or dry heat to sterilize those masks or any equipment between every single use. Now, I did get a response from the VA. A spokesperson said they're following CDC guidelines to, quote, optimize supplies in healthcare settings when there's a limited supply, as we at VA Portland Healthcare System and most other healthcare systems are experiencing across the country. Reporting live in Beaverton, Camilla Ortiz, Fox 12 Oregon.